Good afternoon, Carl Springs. I'm Alexander Falcone, the Director of Emergency Management for the City of Carl Springs. I'm joined here by our Medical Director, Dr. Peter Antevi, and our Assistant Medical Director, Dr. Paul Pepe, sorry, Dr. Paul Pepe. We're here today to discuss the coronavirus with you, COVID-19. We want to discuss some of the steps the city's taking to prepare for this and also discuss some of the facts and some of the signs and symptoms and some steps that you can take at home. So here at the city, we get all of our direction from our medical director and our assistant medical director, and that's how we determine what decisions we're going to make for city staff and some of the suggestions we're going to make to you as citizens. So we wanted to get it straight from the experts. So if you wouldn't mind, Dr. Antevi, can you start off by just providing us with an overview of what the coronavirus is, why we're concerned with it, and what makes it different than influenza or some of the other viruses we deal with on a normal basis?
Sure, absolutely. Good afternoon, everyone. I'm Peter Antevi, joined by Dr. Pepe. The coronavirus, Alex, is a virus that is new to the world, and that's, I think, why people are getting a little concerned. But I think with some information, some knowledge about the virus, we could all live and understand it so we can kind of move forward in a very healthy manner. It's different from the flu in that the flu's been around for a long time. The coronavirus is a brand new virus. If you look at the coronavirus and now it's spread across the world, what we understand about the coronavirus is that it is spread either by touching the virus and putting it to your face or to your nose. And I think that type of spread is really what we're trying to get across so that we can minimize the spread to other folks in the city. Dr. Pepe?
Yeah, the only thing I would add to that is that, coronavirus is a family of viruses that actually caused the common cold or SARS before and all those, so it's a family, but this is as again, we call it a novel virus because we haven't seen that specific type and the way it infects. It's a very infectious disease, but we're learning more and more about it as we go along because it is new.
So you mentioned, doctor, that this is spread by touching a surface or being in close contact with somebody that has the virus and then touching your own eyes, mouth, or nose. So that seems like a lot of the steps we could take to prevent catching it are similar to what we do with the normal flu or with any other virus. Can you elaborate on that a little bit?
Yeah, I think that the most important thing that someone can do to prevent themselves from getting this illness is to reduce the exposure to the illness. And that means staying away from, let's say large groups of people who may have it. If you have someone who's not feeling well, to not be next to that person. And I think that hand hygiene, washing your hands, washing surfaces at home, understanding that the virus is spread person to person, that's the important thing.
Okay. And so we've gotten a lot of questions from our residents. Some of our residents are retired, but they have a spouse or family members in the house that still work. And they were curious about some of your tips and some of your recommendations for them. If you have a spouse or family member working, they maybe they're exposed to the virus unbeknownst to them. They bring that home. What are some of the steps they can take for disinfecting services, disinfecting themselves, their clothes, or anything else that may have inadvertently become contaminated?
Yeah. Well, I think that I just think of this as my own family member, what I want to do because I am out in the public and so on. But I think the main role here is just do what we probably should have been doing all along. This isn't news in terms of washing our hands and so on and taking care of like clothing, for example, just washing it thoroughly. But part of the other thing is to make sure if you're touching objects that other people touch, even on a day-to-day basis, it could be a towel, it could be utensils or whatever, make sure they're not getting infected on a day-to-day basis. It could be flu, it could be anything else that you're carrying. So I think it's just more of a generic precaution that we should take. Maybe there's a good side to this in the sense that we're learning what we should do in general to be better in terms of our hygiene.
Gotcha. And so I've noticed a lot of people have asked us what kind of supplies they should go out and buy. If you've been to Costco or Sam's Club, you'll notice water is bought up by the case. And I think we just want to reiterate to the public that there is no information we've received that indicates supply lines are affected by this, or we're not anticipating resource shortages in those areas. So a question came in, what we would recommend you go out and buy. We're not recommending you go out and buy and stock up on a bunch of supplies. Everything that you need to help prevent the spread of this virus, you most likely already have. We're recommending hand washing with warm water, using soap, making sure you're washing your hands for at least 20 seconds. All the same things that we've been reiterating for years. The only difference with this, as you mentioned, is that it is a new virus. It's new to us, and that's kind of what maybe is drumming up some of this hype. Is there anything else you'd like to add to that?
One thing is that, let's say if you go out, just think about what other people might have been touching, because a lot of people basically may have an infection and don't know they have it, and that's one thing we're learning. But I just approach this every day. It's just part of my normal life. If, for example, if I go to a place like there's a cafeteria, or if it's a part of a catering line or whatever, other people are handling the same things I might be handling. So I make sure that before I go into the line, I've put, let's say, sanitizer in my hand, and when I get off the line, I'll do the same thing. And you just sort of get a mental check to not handle things other people have handled. Could be a menu, for example. Yeah, at the same time, it's not a problem handling the menu. Just make sure your hands are clean before you start doing anything that may put, food near your mouth, or inadvertently if you touch your eyes or mouth, as you were saying.
And I think, Alex, the best example of that are the cruise lines. It's a place where a lot of people are together. They're at the food line together. They're playing bingo together, whatever you do on a cruise ship. And I think that those people are transmitting the disease one to the other because of those kind of unsanitary practices, the fact that you're with a lot of people all the time.
But keep in mind that this is what happens with the flu as well, and many other disease processes. And that's why I think this is probably in some respects a good learning experience for us all to actually help decrease the transmission of disease in general.
So you guys have mentioned the flu, and Dr. Antevi, maybe you can give us a little bit more background. When we say flu-like symptoms, what are we talking about? What do people need to be on the lookout for when we use that term?
So the flu or any upper respiratory virus starts up in the upper respiratory tract, nose, runny nose, coughing. You'll get body aches, you'll get headaches, you get a sore throat. So those are flu-like symptoms, and then of course fever is another one. Now what we're concerned about with coronavirus, those people who do get the lower tract disease, meaning it's not just the upper airway, but it drops into the lung. That's when the coronavirus seems to cause more problems, and those seem to be more elderly people or those who have other illnesses like chronic lung disease or heart disease and so forth. So the flu-like symptoms are those symptoms that I just described.
So if we're a healthy adult and we don't have any underlying medical conditions, is this something that you're particularly concerned with if I were to be your patient?
I'm not, and that's why most of those people who have, if you show up to the emergency department today with a flu-like illness and you're a well person with normal vital signs, they're going to tell you to go home. And they're going to tell you to just stay at home and try and not infect other people. And so that's exactly what we would do for any other flu-like illness today in the emergency department. So we don't want people flooding the emergency department. We don't want people flooding their doctor's offices. We don't want doctors sending people to the emergency department, because if we have 100 people, 80 of which have no problems except a little runny nose, those 80 people don't belong in the emergency department.
And the other thing is that the odds are maybe you'll actually contract something from the other people around there coughing and so on. So it's kind of a self-protection thing as well. On the other hand, what we don't want to make sure is that people are sick, that they don't seek help. But seeking help may not mean that you just get into the car and go to the emergency department. I think is a little bit what Dr. Antevi is saying, is that part of it may be also having an access resource, like I've got this and that going on, should I come in or not, and so on. Peter, what are you recommending for people in terms of where they should call and what they should do so they don't necessarily go into the emergency department, either one, expose themselves or add more burden to those emergency departments?
That's a great point, Dr. Pepe. I would say everyone should contact their normal healthcare provider by phone and get some information and guidance. You have to understand that if you call your doctor and say, I want to come in to have an appointment right now, they may not have an appointment right away. There should be I know we have a hotline that we can put up on the screen here. We have resources here at the city. Your physician can give you resources, but the first thing to do, and Dr. Pepe mentioned this, is to not just rush to the emergency department. There are lots of resources, and the city will make resources available for people to call and get more information.
So if you are experiencing signs and symptoms, just to kind of summarize this, we are recommending that you reach out to your normal medical provider. You get guidance from them. If you're experiencing signs and symptoms, the Florida Department of Health also has a hotline set up, which we're going to put up on the screen. That phone number is 866-779-61 888-211. And once again, if you are experiencing signs and symptoms, we're recommending that you don't go to an ER, you don't go to a hospital, you keep yourself away from the public because you want to try to prevent this. And one of the questions that came
Well,
in
before you
was,
go further, I mean, just remember, that's if they're mild symptoms, because if a person's having shortness of breath, if a person's where they're really in distress from this, they know when they're sick and very high fevers, then, don't avoid going in if it's under those circumstances as well, so.
And with this, something we've heard is a term called social distancing. Can you please explain to us, when we use the term social distancing, what are we talking about in that? And one of the questions we're getting in is people are asking, do you advise against going to concerts? Do you advise against going to other special events? If you could please just give us a quick overview of that, we'd appreciate it.
I think I'll use the cruise ship analogy as the anti-social distancing, right? You're playing bingo with people, you're in the dining room together with people. So social distancing is just kind of being in an environment where you're not kind of forcibly put with many other people together. And so if at all possible, you should be alert to not go into venues that have masses of people. You will soon see, like the federal government just sent out a notice today to people to urge them not to go on cruise ships. You're going to see that more and more. You have large events, South by Southwest, very large events are being canceled to maximize the social distancing aspect of it.
So, I mean, some of it's also just intuitive. It's kind of common sense. And so, for example, should I be distancing myself from him right now or you, but you're not actively coughing or sneezing and so on. And as a result, because that's where most of this is really transmitted, what we call it's aerosolized. And so it's intuitive that if you're 5 feet away or even 10 feet away, you're less apt to get some of that. That doesn't mean that you're completely protected, but the further away you are, the better off you are from that, that's whatever that aerosolization of the virus that may have taken place. And the other thing is that not only is it is that a risk, in other words, the closer you are to someone who's coughing, but the other issue is also the severity of their illness, and so you're more apt to get contraction of disease from someone who's very sick, and so those are the two factors that I think about. But if someone's not sick and they're not coughing, it's probably fine. But in general, keep some distance, and all that. And again, we're doing the usual thing where we're not shaking hands. It's such a temptation. We want to show a good, strong handshake, but we're doing either it's a fist bump, or some of us are just doing elbows, or sometimes just whatever. But to acknowledge, or just saluting if you have to, in those circumstances.
And I think those are all great points. If you look at what's happening to the extreme of social distancing, you look no further than what's happening in China or Singapore, where they're mandating it. That'll never happen here. So I think that the American public, and specifically the people in Coral Springs and Parkland, need to realize that they'll have to manage their own social distancing. There's no governmental agency that's going to come and mandate anything, but there will be some events canceled, and I think that's the right thing to do.
So on the topic of self-managing your social distance, we're getting a lot of questions about people taking trips. They have pre-planned vacations, some of them out of country. One of the questions we have for Maria is that she has plans to travel to Spain in 2 weeks. Should she still go, or do you recommend that she cancels her trip? And if you can provide a little bit of background on some of these travel advisories we're seeing out of the CDC.
I'll start, and Dr. Pepe, if you want to continue, but I'm one of those people, right? So in 2 weeks from now, I'm canceling a trip simply to, within the United States with my family. That's been canceled, but that's my decision to make. At the end of the day, when you're in an airport, when you're in an airplane, when you're in a country that you may ultimately get sick in that country, you really have to have all the plans. So that's a personal decision. Was it Maria, you said?
Yes.
Maria, it's a personal decision, but I would say that it's a decision that you have to kind of make based on your own family's concerns and needs and so forth. But I would say that you'll see a lot of plane trips being canceled. And any other thoughts, Dr. Pepe?
Yeah, so I actually have flights coming up too to various places in Europe, for example, in the near future, and as well as other places around the country. And I probably will go ahead and do that, keeping in mind that if people are coughing, I will be concerned about that. But I'm hoping that the airlines are now checking on that and watching that's part of what they're doing at this point in time. But let's say, for example, right now, for the person talking about going to Spain, Spain's been pretty good. I mean, there hasn't been a big influx of things, but will it come? likely sometime, but I don't know where and when. So many people are not necessarily changing their plans, but I would keep an eye out on what's happening in different countries through the CDC. And there will be advisories on this. And so far, the places I'm thinking of traveling, there's been no problem whatsoever.
And if you do travel, you have to be sure to, and I hate to say this, but when you sit at your seat, and I'm not the germaphobe here, but I can tell you that I do now carry some wipes with me, and I just was on a plane 2 days ago, and I did wipe down the area. I managed not to, again, try not to touch my face if I can, and you really have to take those precautions when you're traveling. In the airport, believe it or not, I only saw one person with a mask on this time around, but I do sense that in the next couple of weeks, you'll see more and more of that.
You know, the German philosopher Goethe once said, "When facts are scarce, words soon take their place." And we're still learning more and more about this. And it may very well be that surfaces are not contaminated with this particular mist. It may be all just aerosolized. But for now, we're taking the approach that it's not just the corona. It's so many other things that could get onto those surfaces and then that brings up a very good point, which is that if you go get a certain product, read the label and see what it says. Like, do you cleanse it and then you wait a little while before you wipe it off? And so there'll be different, directions for different things. Just like we're saying, wash your hands. Well, we're saying do it really well with soap and do it for over 20 seconds and so on. And make sure you can even make your own sanitizers out of alcohol and maybe aloe vera if you can find it nowadays. But I think you can, and it's things that you can carry around for yourself and make sure that you are, think to yourself, I'm going to touch anything else, I'm going to sanitize.
And so we had a couple questions coming in. Some folks were wondering, do we know where in Broward the people have tested positive for the coronavirus? And if you don't mind, I'd like to kind of hit on this point. A lot of people have been asking where in the county these cases are. And we were discussing this in city staff meetings. And I don't think it's important for us to focus on where in the county these folks are, because most likely if we're going to come in contact with somebody who has the virus, we're not going to know that we're coming in contact with them. So the best advice that we can give you is to take our doctor's advice, follow the proper procedures, make sure that you're keeping up in your personal hygiene, because likely if there is a case that's located in the city of Carl Springs or located in your community, if you're not from the city of Carl Springs, you're not going to know about it until after that person's already become sick. They've gotten tested and they've gotten those results back. So I think it's prudent for us to make sure that we're taking these precautions, all the time, not just waiting for a confirmed case to be located in our neighborhood. So if you have anything to add on that, I'd welcome that comment.
The only thing I have is a general comment is that just think about common areas that other people touch that you would now touch. It could be a computer, maybe in your own home if you're worried that someone else is sick there, but it could be out in public places, again, things that you might touch that they touch if I come to a doorway. So a lot of times I'll have a piece of cloth with me if I've just washed my hands and make sure that as I open that door, as I go out, I'm going to protect myself a little bit more. This is not going to be perfect, what we do. We're not going to, but we will try to make it better, and that's the whole thing until things like vaccines become available.
And then I'll add on by that. There's absolutely no reason to actually be concerned with where other people are with the virus, because within weeks it's going to be more widespread, but it's just going to be most people will have a simple flu-like illness, and so people should not concern themselves with where in the city, where in the county, because it's likely been here for a couple months already. We just don't know who has it. There's no need to concern yourself with where these cases are.
And so we have a couple questions in here. Alan asked a question. Should we wear any masks if we're sick to prevent spreading viruses, or should we use it to prevent getting sick in the first place? And I know we had a pretty lengthy discussion about different types of masks this morning, so if you could please give us a little bit more information on that.
You can take that one.
Well, overall is that if you're well and you're not coughing, we wouldn't advise that you necessarily have to wear any kind of mask at that point in time. It's usually if you're spreading it around through sneezing, coughing, or whatever in any manner, that's when you need to be talking about decreasing the load. In fact, under those circumstances, we just say, please stay away from other people. Even your own family members, don't make them sick as best as possible. However, when you are a healthcare worker who has to deal with a lot of cases and see them pretty regularly, and get exposed to people like that, there are special masks that we will use, but we like to preserve them for those healthcare workers. Do you want to take it from there, Pete?
Yeah, so there's a kind of the simple mask that I think he's talking about here, like Dr. Pepe said, will instead of kind of having those droplets go out 6 feet, it'll maybe only go 1 foot around you. But for the healthcare workers, we use other types of masks that prevent the actual virus from coming in. And again, those masks are and should be reserved for healthcare workers. They should not be sold to the public. And for example, we have them in EMS, we have them in the hospitals. The healthcare workers here who are seeing the sickest of the sick are the ones who are at risk.
And we do worry about them because if you lose a bunch of your paramedics to get sick, right, or your hospital workers, then that taxes the system and it makes it worse for all of us in case we do get sick sometime.
So if I'm a citizen in the community, I see a paramedic or a nurse wearing a mask, that doesn't mean that they're infected with the virus. That means that they're taking proper precautions,
Yes.
using personal protective equipment or PPE to make sure that they're not being exposed and getting infected. So.
And again, if on mask doesn't give you, like if even you wear a surgical mask, it doesn't give you full license to go out and be out in the public and cough on them. It really is a responsible thing is to keep yourself, that just adds just another layer of precaution because the particles can go pretty far, and so you want to just decrease the risk to others. So the best way to do it is by keeping yourself isolated from them.
So another question we're getting, Dr. Antevi, if folks have these signs and symptoms and they go to get tested, what does that process look like? How long does it take place? And what are your recommendations for them?
So that's a very good question. Here currently in Florida, there are 3 labs that are testing for COVID-19. What does that mean? It means that if you show up to a hospital today, they can do the swab and they can put it into a little container and then they have to ship it to the lab, which will be here in Miami, and the turnaround time for that lab result will be 48 to 72 hours. So do not expect today to go to any facility and get a rapid turnaround time on these tests. Now that's going to change. And in the next 2 to 3 weeks, my prediction is that the state will be sending hundreds of thousands, if not more, test kits and allow the hospital to actually run the test at the hospital level. So if you go to the CVS Minute Clinic or those types of places, they can run other types of tests, what we call point of care, right away and get the result right away. You cannot do that today. And so people shouldn't have that anticipation of going and getting a result today.
And the other thing is when that does happen, there is a consequence. We'll be identifying more cases, so it's going to look like the numbers are a lot larger, and so on. And then, so don't worry about that when you hear the numbers going. It's because actually we're identifying them now and maybe able to take action quicker than we did in the past.
And just to add on to that, there are countries, so Singapore has a rate where they're actually testing many people. They're getting a turnaround time within 3 hours. And so they actually know what's going on as far as case by case. They even have a drive-through testing site. We don't have that yet, but I would say to people, let's not worry about that right now. Stay at home unless you really are ill. Call your physician and only come to the emergency department if you really need to.
So kind of to summarize, what we're looking at right now is about 48 to 72 hours to get test results back from those 3 testing centers. In the near future, we can expect additional test kits to be available, which will likely result in an increase in numbers. And that doesn't mean that the virus is increasing. It just means that more and more people are getting tested, so we're able to confirm that those numbers are there. So we can tell the public to expect a little bit of an increase as this testing ramps up.
And that, yes, that's exactly right, but there's also another important thing. If you show up to the emergency department and you say, I want to be tested, they will not test you. They have certain items that they need to look for. They need to see that you have flu-like illness. They need to see that you maybe are having some difficulty breathing. Once those tests become available, they will not early on become widely available. The physicians at each of the hospitals will determine if you get tested or not. So just like we don't test everyone for the flu, everyone will not get tested initially for COVID-19.
Gotcha. And so a couple questions I'm having here. One of the questions came in, if you have a child with special needs that's always, touching different surfaces, it's hard to control that. Or if you're just a parent with, a normal child, they're anxious and they're curious about whether or not schools are doing enough to keep this flu down. And if they're unable to have their children make sure they're taking those proper precautions we talked about earlier, what is your recommendation about kids in school and maybe some tips for parents of what they could do with their children to help prevent the spread of this?
So I can tell you that I happen to be boarded in both pediatrics and pediatric emergency medicine. And The good news is that when children are getting this illness, they're getting the upper respiratory portion of it, and that's it.
Okay.
However, someone who has special needs, they're of course at higher risk. So you should take the same precautions. Schools should be taking the same precautions, wiping down surfaces. If you go to most schools today, they'll have now the Purell in all the areas before you eat, after you go to the bathroom. All those things should be in play just like we described for the adult population. There should be no difference. Now, of course, if a child has it and has mild symptoms, but is coming around grandma who has multiple medical problems, is a smoker, that's not a good idea. So parents need to be very cognizant of where children are going because the children can spread it to the elderly who do have a risk of getting sicker and ending up in the hospital.
And so with this kind of going back to the testing as well, one of the questions that came in is, if I test positive for the flu, can I also test positive for the coronavirus?
Yeah.
You betcha. In fact, we've had some cases, even here locally, where people have had, the people who were diagnosed as having corona did have a positive flu test at one time. So they're two different strains having two different effects, and you don't get immunity from one given to the other. So the answer is yes. And so, and again, we're right in the middle of flu season, so that's part of the problem. And there's other viruses, such as other coronaviruses, such as respiratory syncytial viruses. So there's a multiple of things, especially at this time of year, that come out. So we're not sure, but the point is, yeah, you could have both.
And February and March, like Dr. Pepe alluded to, are the peak months for influenza. And here we are.
And that's the reason why everybody has been so strong, about, say, get your flu shot, get your flu shot. Sometimes flu shots in a given individual may not completely protect you, but it definitely makes you less apt to be sick from it. And it also will keep you from, it decreases mortality rates, by the way, but it also keeps you from getting, that sicker but most people are protected. And so it's really worthwhile getting it. And it actually helps the overburden that we may see here over at our emergency departments and the hospitals can be mitigated by people just as we go through the next cycle, make sure you're on top of it. If you haven't got your flu shot already, I'd still get it.
And on top of that, if you do have the flu, you do have medications that you can take. So there's some antiviral medications for the flu, which we don't have yet for coronavirus. So there are some differences between the flu and coronavirus, and that's just another one.
Yeah.
So one of the questions we got in is, you're talking about disinfecting airplanes when you get in, and one of the questions came in, even in the event of disinfection of airplanes, if they're not disinfecting the air vents, what is the risk of infection from that, and do you have any tips for that?
I think that remember, there's two schools of thought. One is that this is just droplet, and I think if people focus on the fact that this is mainly droplet, then they can protect themselves with those Lysol wipes. If we start talking about the aerosol, then it changes things a little bit, and if there is a recirculation, then theoretically that could affect other people, and there's some theory that's what's happening on the cruise ships. And in that particular case, you need to limit your exposure if that turns out to be the case. If it truly is a circulatory happening within the air vent of the airplane.
The problem is we really don't have the data, and we haven't had enough experience to know that that's what's happened. But that's why we track people who come in with it, and they, and we say, hey, there is a corona case where they're on a plane recently. Turns out most of the cases we're seeing here in the United States have been community acquired for the most part. Just having nothing to do with the travel whatsoever. So.
Right.
So on that note, we just got a question from Gina. Should a 92-year-old fly for a family visit?
Gina, 92-year-old. I would say that if you're 92 and you're going to go to an airport and expose yourself, you're knowingly putting yourself at risk. My advice would be to reconsider until we know more. But I fully understand that people spend, they plan a year in advance and you're looking forward to it. I completely get that. If you were my 92-year-old relative, I would advise you to reconsider the travel, personally.
And if someone does, in fact, get infected with the coronavirus, how would you recover? Is it a similar recovery to the flu?
Yeah, again, this comes back to we're just learning this, especially here, because first of all, you can look and see what happened in China or Korea or Singapore and see how it went, but we don't know, for example, what happens here. Sometimes viruses can mutate and it may affect different populations differently, so we are still learning. But for the most part, I think most people have been better within a matter of weeks, or if not earlier.
Yeah, and plus you have to remember in China there's a very high concentration of smokers, and so they're saying that it may have affected the Chinese population more so. They're thinking that obesity may be an issue here, so that people who smoke, again, any of the other issues, obesity, smoking, chronic lung disease, those people are maybe at higher risk for getting the virus.
And let me qualify my answer too, because there are people who actually got it and they may just feel not so good, and then a few days later they're feeling better because it just didn't bother them. Or the person had a mild case of this and didn't even know they had it. It could be over within a very short period of time. And when I talked about the weeks, it may be someone who is very, more moderately ill under those certain. That's kind of what I was referring to. So I think we just, we are still trying to find out more and more about this, and we're going to be learning more and more as the weeks go on.
So we're not getting any more questions at this point. I just want to thank Dr. Pepe and Dr. Antevi for your time today.
Thank you.
The city is going to continue to monitor this. We're taking our preparedness steps just as we would on any other situation, and we're going to provide information to the public directly through our website. Additionally, if you're watching this later tonight when it's not live, you can ask questions in the comments section. We'll be sure to answer those as soon as we get the answers to you. So we invite our residents to continue staying connected with us, and thank you so much for tuning in.